Here we go. Prolotherapy.
Lumbar spine. The Laura is the main hero.
Yeah, this is what's going in.
We're gonna
Look at that. That's my hand. That's the size of the needle.
It's 4 inch.
Eek, that's a big needle.
So we're gonna start. This is the small 1 inch, so we can lay it flat. So it's not gonna hurt as much.
Yeah, that's a big difference.
What did you say?
That's a big difference.
I told you. Still it burns, but not as much. That never can be pleasant.
But it doesn't hurt as half as bad as it did before.
I said that's all in difference in the needle. Because I can lay it flat and go under a very, very sharp angle. This is a 30 gauge 1 inch B&D needle. So it's one of the top needles, the most expensive ones.
Oh, got a little squirt.
Okay.
I'm a twitcher.
That's hurt, because that's a very sensitive area.
My lower back, I twitch.
Well, everybody twitching this one. I don't know anybody who will be able to tolerate it without having this type of pain.
Oh. I wish I had a separate camera, just a short face.
That's another pleasant injection, but again, like they can consider amount of shots. That's about 50, 60, 70 shots, and it's I would say that's a lot of shots. And it should be painful.
Yeah, I would say that's a lot of
So
shots.
this is you're recapping the needle. Again, you shouldn't do that in general situations, but I'm very good at that kind of technique. I'm gonna go. This is a 4 inch needle.
All right, here's the big one.
So you palpate the spinous process. And you go straight down.
Alright.
Okay, with for a jerk. That's the first time I actually inject L2. We're going to inject L2 facet. She's might jump too. This is L2 facet. She won't jump here because this is not the first time I inject that level. This needle goes about 3 inches deep. I usually use 4 inch needle. See, that's a jump. So that facet was really painful. They're gonna do this one. It's L4. Facet. Tip of the transverse process. There's facet. You feel a lot of scarring from surgery?
Yeah.
I can see the scar right there.
That's pleasant surgery.
They're gonna do the sacroiliac joint, and she got a lot of scarring there. Just mix up the dextrose. This is goes straight to sacroiliac. Just, I'm very familiar with Laura's back because this is my number 3 injection. So, you know, like this one I'll have to palpate. You know, but if I'm not familiar with your back, then it's, you know, I have to palpate every time. It'll be right in the hip.
Yeah.
So sometimes you have to press the tissue because, you know, like, you know, people usually have more. Okay, let's do one more. Okay. Here you also have to compress, so you hit the sacral bone because sometimes it's not easy. What you're going to do with the lumbar ligament, you can do it either from L4, L5. This is L4. Inject. Okay. Now we're going to inject, you know, I'm done here. So we're going to do intraspinous ligaments. You know, right now it's not hard, but once I go to the scar, it might be a little more problematic because it's not going to be very easy to cut. Closer we come to the scar, see now it's become very difficult to inject. If you scar a few, I have to put a lot of pressure because I'm getting immediate results. A lot of resistance to the scar. Okay. We're going to go from the outside. Got about 1.5, a little bit more than 1.5 syringes left, so I'm going to need to reload one more syringe. So I hit L2, L2 facet. This side is not going to be a standard because Laura is mostly on the right. I'm used to when the patient looking to this side, to the left, because that's just the way I used to do it. So every time the patient lay like that, it's ease up my procedure, and it's make my job very easy. I'm a man of a habit. But again, you know, she's a very good patient. You can see how steady she is. She doesn't move much.
The lack of trying to punch you.
Oh, I'm sure she want to punch me. The thing is, you know, but she's not doing it because she like me, because I'm good looking. She do it because, you know, this is actually hurting her, and it provides her decent relief. You know, so far, you know, like you can see, the scar of that horrendous surgery, and it didn't do her justice. It's just a failed back syndrome, so nothing else can be done to relieve her pain. So that's the last attempt to eliminate her pain, and apparently it does work. So, you know, it's according to Laura, it does change her life.
Yes, it does.
So the thing is, at least it did when we did it her ankles and knees and neck. The low back is a little more stubborn again because she got the surgeon. Unfortunately, she let the surgeon touch her first, and now she left with this type of stuff, which is. Okay, now I'm out, so we're gonna reload the syringe, and
Yeah, recall what we started with. That's what just went into her back.
yeah, I'm not Now I can need a couple more. So I need 6 cc of dextrose. I mix it with 3 cc of 1% lidocaine. Some water. Again, I did clean the caps before, so I didn't touch them, so that's why they're clean. I would not leave. And I'll discard every single vial after I'm done. I'm gonna keep them.
That's quite an extensive process.
Well, it takes a while. I mix my own medicine, so this takes some time. But again, this is why I can make it affordable, because I do my own medicine. I prepare my own medicine. And I mix the dextrose because it is very thick. It's like a syrup. So
now that's the back.
Laura's catching a break because of me reloading. Usually I didn't know it's going to be that much, so I need 8 syringes. But unfortunately did.
I doubt the week of heart will make it this far in the video. Probably up to 12 minutes. There we go with the 4-inch needle.
That works very nice. This needle does not discriminate, cuts nice and easy. And it's a sharp, fresh needle. So it will go through, pierce through the flesh nice and easy. And sharper the needle, the easier it is because it doesn't hurt as much. So you want a sharp needle versus dull needle. This way I do switch the needles in between. Laura doesn't have a lot of ligament tissue yet. This is why I don't need to switch a lot of needles. 2 needles is more than enough. But once we can develop some ligaments, that will change. Okay. This hip is not as bad, so just 1 cc would be enough. I'm going to do this.
Yeah, it's always been my right side that's been worse.
Again, reload. Okay, well, right. That's all 4. The field L4, I press the tissue so I can hit the crest. Okay, now I hit the crest. Now I'm gonna walk the needle like a through the drum. And now I go in. And you can see the needle goes right into the 4 inches deep. That's how deep the lumbar ligament. Actually, that one feels not too bad, but on the right side is very degenerated. So most of her problem is the right side. The left side looks pretty nice. But again, we'll have petrified because that has done with the problem with ligaments. So whatever. I'm done. So what we'll do is now we're going to clean up, and
And that concludes the prolotherapy.